Hi, everyone. Good afternoon. My name is Brooke Sheeran, and I'm a senior analyst here at CAQH. I'm really excited to welcome you all to our 2025 CAQH Index webinar. As you may know, we just published our 13th annual index report and launched our new digital platform, Index Pro. Today, we have esteemed panelists who are joining us to help unpack the latest index findings so we can close automation gaps and deliver meaningful ROI in the industry. Before I go ahead and turn it over to our team and our guests for today, I'm going to run through some quick webinar logistics. We will be recording this webinar and also saving a copy of the slide deck. Anyone who has registered or attended the webinar will receive a link to the recording and deck in an email in 2 to 3 business days. All audience members will have their microphones muted during the webinar. However, we do encourage questions throughout the presentation. If you have any questions for our staff or panelists, please feel free to submit using the Q&A feature at the bottom of your screen. At the end of the presentation, we will have a few minutes to go through those questions and ask some of them live. With that, I'm going to go ahead and turn over to Erin Weber, our Chief Policy and Research Officer, to run through our agenda for the day and provide an overview of the index report.
Great. Thanks, Brooke, and thanks everyone for joining us today. For more than a decade, the CAQH Index has been a trusted resource for leaders across healthcare. It has been used to track progress, identify opportunities to reduce waste, create policy, and guide investments that improve administrative efficiency across the system. But we've also consistently heard from the industry that these insights alone aren't enough. Leaders really don't want to just understand the national trends. They want to understand what the data means for their organization and how to translate those insights into action. And that's really what Index Pro is about. This year's findings reinforce something that many of us are experiencing firsthand. We're seeing real momentum in automation, new standards, emerging technologies like AI, but that progress isn't yet translating consistently into system-wide efficiencies. So there are clear areas of advancement, but also important gaps that signal where focus and investment matter most right now. So today we're going to do 3 things. We'll start with a quick overview of the index and how it continues to serve as a trusted benchmark for the industry. From there, we'll walk through a live demo so you can see how these insights can be explored in a more dynamic and practical way. I'm super proud of what the team has created this year. Then we'll shift into a panel discussion where we'll bring these themes to life. Our conversation is going to bring perspectives from key index users. They're going to touch on what this year's data reveals about industry resilience following the Change Healthcare cyber attack, how organizations are leveraging and thinking about AI, and then how do we move beyond compliance and more towards true interoperability that delivers value across stakeholders. So I really regret to share that Matt McCormick is unable to join us today last minute due to illness. We're really sorry to miss his perspective and hope he feels better soon. Fortunately, we have 2 other great speakers to dive into these topics, and we plan to get your perspective on a few topics as well. So we'll leave time at the end for questions and comments and share ways you can continue exploring the index findings after today. So with that, let's start with a quick look at what the index is measuring. At its core, the index tracks the administrative workflow that supports end-to-end patient encounters, from scheduling and eligibility to prior authorization to claim submission and ultimately payment. These are essential steps to delivering care, but they're also where a significant amount of time, cost, and complexity exists across the system. What makes the CAQH Index unique is that we don't just track whether these transactions happen, we measure how they happen. So we collect data from both providers, over 600 this year, and health plans representing about 63% of covered lives in the US to understand whether transactions are manual, partially electronic via portals, or fully electronic using standards along with the volume, cost, and time required to complete them. So that gives us a clear view into where inefficiencies exist and where there's real opportunity to reduce burden. And that matters because this isn't just about operations. Reducing manual work frees up provider resources and helps ensure that patient experience results in fewer delays and fewer points of friction in accessing care. As the industry evolves, the index is evolving alongside it. So we're now also tracking newer capabilities like AI, buyer-based APIs, and electronic prior authorization as they're being implemented. So the index is increasingly a forward-looking view of how administrative processes are modernizing, and we'll be releasing new findings throughout the year. When we looked at adoption in this year's data, a few important themes stood out. On the medical side, electronic adoption improved or remained stable across most transactions. On the dental side, we saw a bit more variability. Because this year's index represents 2024 data, you might remember that there was a big event in 2024, and that was the Change Healthcare cyber attack. During this timeframe, many organizations understandably prioritized system recovery and stability, which temporarily slowed new automation efforts. But what's really interesting in the data is that the existing electronic infrastructure really held up. We saw stable adoption that helped protect providers and patients from more severe disruption, limiting payment delays and helping care continue. At the same time, the reliance on manual and hybrid processes like portals during recovery highlights an ongoing risk. These workarounds increased administrative burden, slowed reimbursement, and introduced more opportunity for errors that could ultimately affect patients. So the takeaway here is that we've built a more resilient foundation, but the next phase is really about continuing to modernize so that resilience and efficiency go hand in hand. So I'm going to close this section with one of the most important takeaways from this year's index. There is still a $21 billion annual savings opportunity across the industry. $21 billion. Today, the industry spends about $82 billion on administrative tasks a year. If all of those tasks were done manually, the total cost would be well above $300 billion. So the automation that we're seeing is already delivering significant value. It's reducing cost and complexity across the system. There's more to be done, though. We're encouraged that even in a year with real disruption, administrative spending actually still declined. Higher electronic adoption and lower per transaction costs help offset the impact of temporary manual workarounds. So in the context of the cyber attack, that's an important signal. Automation didn't just create efficiency, it really did help stabilize the system and limit broader disruptions. For providers, that meant fewer resources diverted from care, and for patients, it meant fewer billing issues and a more predictable experience. At the same time, that remaining savings opportunity, $21 billion, shows that there is still more to do. In some areas, especially where manual processes increased during recovery, the opportunity for savings actually grew. So the conversation we're having is really starting to shift. It's not just about identifying new efficiencies, it's really about protecting and extending the efficiencies we've already built, especially as the system faces new pressures like cybersecurity. I know just this week, hospitals were put on high alert given world events. And so this raises the next question, which is where can we extend these efficiencies and how should organizations prioritize them? So with that, let's take a look at how you can explore these insights in more detail. I'm going to turn it over to Christine Bernaska, our Senior Director of Research and Measurements and expert on all things related to the index and data, to give you a demo of our new Index Pro tool.
Great. Thanks, Erin, so much. And thanks for everyone for joining us today. We are excited to highlight the features of our new digital dashboard, Index Pro, which allows users to interact with the index data, filtering on relevant transactions, being able to sort on various workflows, and also be able to look at different investment scenarios. So in order to access Index Pro, you need to subscribe. And in order to subscribe, you need to just enter a few of your individual information, your name, as well as your title and your work address. Once you submit this, you will receive an email to your inbox, which will then allow you to access Pro. After you've subscribed and you get your email, you will have access to Pro's 4 core tools. The first being the interactive chart book. The interactive chart book contains all the transaction level data that was initially in the initial annual PDF report. What you're able to do here, though, taking it to a new level, is a user is able to interact with the data. A user is able to decide what type of data they're going to look at. If you're interested in looking at detailed administrative workflows, the transaction level data, you can sort by the workflow process that you're interested in, identify whether you're a medical or dental industry, and then be able to look at the key metrics, whether it's adoption, volume, or cost. You are then able to see the tables associated with those. And when you take a look at that, you're able to see not only the trended data, but we also then provide you with some data insights, which provide you with some contextual findings, along with the definition of the transaction, and then we provide you with industry impact, and that's kind of the so what. So what's going on with the data? A user can see this for each of the transactions that they are interested in. The interactive chart book also provides the cost and time data, which is of great interest to individuals. You're able to see the cost and time data by mode as well as by transaction. You're also able to see it by plan, provider, or industry, along with those cost savings opportunity. In addition to the interactive chart book, users are also able to get to the ROI calculator. This is the heart of Index Pro. We're really excited about this. Users are able to come in and not only see what their annual savings is by switching from manual transactions to automated transactions, but they're also able to take it one step further to determine how much they should invest and what their ROI will be. So when you come in initially, you're able to go and select what industry you are, medical or dental. You're able to select the administrative process that you're interested in. Whether you're a health plan or provider, you're able to select the administrative process that you're interested in exploring, eligibility and benefit. And then when you do that, you're then able to determine how many of those transactions you would like to convert over to be more electronic. So the current volume is the volume that you are currently doing in-house, and then you set your goal. How many of those transactions would you like to target to become more electronic? Once you enter that data, the calculator will automatically calculate your estimated savings. Because we know that you need to invest in order to obtain those savings, you're then able to go to the second part of the calculator and play around with some investment scenarios. You're able to enter your initial investment amount, your annual recurring cost, and based on those numbers, you then are able to see your ROI and break even year. And then we don't stop there because we know you have the data and we know you've given you a lot of information, and you may say, so now what do I do? Based on the information, we offer you a 1-hour advisory session. That session allows you to meet with experts on our team to work through and determine how you can action on the data. How can you then obtain those savings? What do I need to do? We will provide you with a workflow evaluation or perhaps a gap analysis. The other key tool that we have within Index Pro is Ask the Index. This is an opportunity for users to dig deeper into the index and ask questions based on our LLM model. This model takes into account the various research that we've conducted internally as well as externally, and users are able then to get a better sense as to what their data means. So with all of this, Index Pro is a great tool for any entity to come in. You're able to benchmark your data. You are also able to come in and look at various investment scenarios and use it for strategic and operational growth. And with that, I will turn it back over to Aaron.
Thanks for the overview, Christine. I just have to say, last year the index report was a 75-page PDF report, which I know everyone on this webinar read every page of. But we've really evolved into this truly interactive dashboard where you can get the data you need quickly and efficiently, and then also use your own information to understand benefits for your own organization. So I want to turn things over now to our panel to provide some insight on this year's findings. So let's start with quick introductions. I'd love for both of you to just share a bit more about yourself, your role, your organization, and how the insights from the index support your day-to-day work. And how might you use Index Pro to strengthen decision-making and deliver more timely outcomes? So Tom, I'll turn it over to you first.
Left myself on mute. Thank you for having me, and welcome to everyone here today. My name is Tom Castles. I'm a managing director at Manat Health, a strategy consulting, legal, and policy consulting shop. I think in my career, I spent 15 years working with health systems at the advisory board, about 8 years working with health plans, first at Optum, then through various technology companies, some of which were building the building blocks for automation. And now I work across the kind of value chain, with everyone from life sciences to payers to providers, and health tech companies. I think, one of the things that I spend a lot of my time on right now is the cultural reaction to automation, and also the communication of what that automation means for workforce. And I think one of the things that is really powerful about the data that this tool shares is, it really shows that automation is not new to this environment, and can be shown to have been a real force multiplier effect for the administrative side of payers, providers, et cetera, kind of dampening the myth of automation means immediate job losses. I also think that around prior authorization, there's so much talk, actually focusing on the tools that allow organizations to, quote unquote, mutually disarm in the AI for prior auth race, is something that I think, again, this tool can kind of share, that this is an issue that we we all hold really dear, and not least of which is our patients. So there are any number of clients that I think really use this data to culturally bring along their boards, their administrative staff, their clinical staff, and really grow the impact on total cost of focusing on the administrative side.
Thanks, Tom. Pam?
Hello, thank you so much for including me. Congratulations on transforming this your very valuable report into this amazing platform. But I want you to know that I did read all 75 pages of that PDF for the past 3 or 4 years. So I'm Pam Johnson. I'm a practicing radiologist. I spent the last 10 years as leading the last 5 years as the Vice President of Care Transformation for the Johns Hopkins Health System, where I was the physician lead for care redesign across the enterprise to improve our clinical effectiveness and efficiency. And many of the initiatives that we developed included technological innovation to facilitate best practice. Particularly, we had a program around appropriate use of advanced imaging to comply with the CMS mandate. They had an appropriate use mandate for the PAMA regulation, and spent a lot of time working on that and developing platforms that could automate appropriateness assessment at the point of care. This became more important because over time, because it's not just the leading source of provider burden dealing with the prior authorization process, it's also become one of the leading sources of patient anxiety, stress, and burden. So we worked very hard to automate, and this is when I discovered the CAQH Index about 5 years ago. And the data that was in there is nowhere else. There's no publications in the literature that can help you understand the actual progress that's been made with automation and interoperability. And it was fascinating to me to see how much progress has been made in 5 of those 6 pillars that you demonstrated, and how the prior authorization portion is lagging behind. Well, that was where we were doing all of our focus, and it's a very hard thing to try to conquer in terms of automation, but it's critically important. And the reason is that when the patient and the provider sit down to have a discussion about, okay, I think that you need this test, this MRI, it's best to know immediately whether it's going to be approved. And that's where we need to go, so that the patient and the provider can have shared decision making about what is the next step, rather than having to wait for the turnaround time to make sure that the health plan and the physician are in alignment on what should be done next for the patient. So in summary, that data empowered me to say we're going to continue with this, to show to the leadership, look, this is where we really need to invest our efforts. We need to, because and you break it down to, like, for every dollar spent on the prior authorization, there's a portion of it that is being invested by the health system, and there's a portion of it that's being invested by the health plan, and everyone's going to benefit if we can come together. It also became a driver of better collaboration for us with our own health plan, with other health plans, and forming this coalition that Christine's been working on with us, where we have come together and tried to partner in solutions for this work around the interoperability and automation. So it's a tremendous resource, and I look forward to the new tool.
Thanks, Pam. And for those of you who haven't read even the executive summary yet, what Pam is talking about is when you're looking at prior authorization compared to the automation of the other transactions, thinking eligibility, claims, payment, it's like this massive dip, right? Most of the transactions are somewhere between that 70 and 95% mark today. prior auth actually increased 5% in terms of automation from last year, which is one of the biggest jumps it's ever had, but it's still only at 40%. So, not even half of the transactions are being done electronically. So we do have some upcoming rules from CMS around automating prior authorization using APIs, and we collected some data on readiness for that in this year's index as well. So we look forward and are kind of crossing our fingers that over the next year or two, we'll see some pretty big jumps in the data, particularly as those FHIR APIs get implemented. But stay tuned. And for those who weren't here at the beginning, Matt, unfortunately, is ill and unable to join us sort of last minute. So I'm going to try to weave in some of the vendor perspective as well around the value of the index. And one of the things I hear when I'm at conferences is a lot of vendors will stop by and say to me how much they rely on the index data to help quantify the value of their own solutions with their customers. And so part of our thinking as we evolved this was how do we make that easier for our key users? So that's why I'm especially excited about the ROI calculator. So based on that kind of that feedback, I'm curious from our audience perspective, how does your team use Index Pro, or how do you see your team using Index Pro to drive savings and smarter decisions? And we have multiple choices available to you here based on each of the kind of updates that we've done this year, from the ROI calculator to being able to benchmark performance, looking at the impact through our data insights, using the AI tool, or potentially through our advisory sessions with our team to help understand the data a bit better. So if you don't see it here, drop your answer into the chat. Look forward to hearing a bit more about how folks are using the index. And Pam, I'm really excited about the work that your team has been leading. It just such an important piece of the care experience and how we are making things easier, really with the patient in mind. So, do
Thank
we
you.
have poll results? Yeah. Go ahead, Pam.
I was just going to say, really, the solution lies in collaboration. We've got to all come together. It can't just be, and the CMS mandate, I think, is going to help a lot, but it still needs to be a collaborative design and implementation.
Yep. Okay, I am not seeing poll results on my end, so I'm going to keep us moving. I mentioned earlier that findings from this year's index really focused on 2024 data. And so that is, the year of the Change Healthcare cyber attack. We all heard the news. If you were in healthcare, you couldn't miss it. Claims processes were very slow, payments were disrupted. It was a huge challenge for the industry, but in particular impactful to providers. But the data shows that the industry still avoided $258 billion in administrative costs, which was actually a 17% increase from the prior year. And this was really driven by lower electronic costs per transactions and more transactions that were automated. So it really showed that we are improving our cost management and efficiency. And so for our panelists, and I'll start with Pam, from your perspective, what do you think drove this resilience over the course of the year, and what must stakeholders do together to ensure systems are connected, reliable, and timely going forward?
Well, I think that the providers and the patients were a major factor in driving this. That the providers are advocating for timely, efficient care delivery. The patients are also advocating for their own health care to be to not have the delays related to interoperability barriers. And it seems that the health plans have done a phenomenal job listening and trying to respond to these. You've seen a massive shift from the traditional, use of fax and phone already, which is a huge improvement. And we're seeing, a lot of innovation from the health plans and then also CMS. So it's sort of from the bottom up and the top down, everyone's coming together, everyone's on board, everyone in the country agrees that we need to tackle this across the whole healthcare ecosystem. And I think they're all willing to work together for the patient really at the center.
Yeah. What's your perspective on why we didn't see huge blips in the data during 2024? Is it that it smoothed out, the course of the year we averaged out and it was just an initial decline? And what were you hearing from your stakeholders?
Um, I think resilience comes from extreme pain sometimes. I would say the pain that both providers saw because they continued in their vocation to their patients, regardless of payment slowdowns, and the reaction of payers to really move into a space that frankly was a risk for them as fiduciaries, but to cover the losses that providers were seeing, I think showed both sides that there was a material effort to mitigate what was, a real a disaster for a time as quickly as possible. And I think that actually counterintuitively built up more trust than had been there before, even in light of the kind of facts on the ground.
Yeah, yeah. So there's a theme here, right? The reason we didn't experience quite as much pain as we might have was the collaboration between the different stakeholders and the willingness to come together and find creative solutions quickly so that we could get things moving again, which I think is a credit for an industry that's not always known for working well together. Another area that we focus on in the index every year is around the use of AI and its accelerated use in healthcare. And I think this year we asked about the use of AI for administrative transactions. And we heard from plans that about 50% of them had already, and this is 2024, so we're probably far beyond this at this point. About 50% had already implemented AI for administrative transactions, and about a quarter of providers were talking about AI at that point. What are both of you seeing from an AI perspective? Where are you seeing it deliver the most impact, and how can it be leveraged more to help close that $21 billion savings opportunity identified in the index report? And Tom, I'll put you on the spot first this time.
um, you know, I think one person's cost is often another person's revenue. Um, and I would say that we are at a point, and full disclosure, I advise both providers and payers in the AI space around prior authorization. I think that there is a shared understanding that we should be able to solve this, and it might get solved by the government, like to us, if we don't come closer together. And I think that has been a positive this across the last several years. Um, but I would still say, movement toward automation will move at the speed of trust. And while there are some organizations who have invested significantly in automating parts of the prior authorization process. If you can't get all of your payers, if you're a health system, to engage in the same automated fashion, and you can't get a critical mass of your network to engage that way, it's not a he said, she said game. It's just reality. We don't naturally make the same choices of which tools we're going to use. So, one of the things that I think is interesting is the work on the part of the federal government to really push forward for standards around prior authorization. And I think that's one of the sharpest efforts, really from the beginning of the Trump administration, and backed by Dr. Oz and certainly other leaders.
Tom, before Pam goes, if you have a crystal ball, when do you think we'll start seeing and feeling real results as patients? Is this, in a year or two, we're going to be there and 80-90% of prior auths will be automated, or is it further out?
Um, I My crystal ball is hazy. My it's the first day of the NCAA tournament, so gambling is legal and not frowned upon. If I was if I was putting money on this, I would say it's going to take several years before we see substantial kind of uh, you know working toward standards in this space. Uh, some promises have been made on the payer side that are not immediately translating to action, which is creating some frustration on the provider side. But I I think it's going to take a couple of years to get there.
Yeah. Pam, I have to put the same question to you then.
Yeah.
In your NCAA tournament crystal ball, where are you placing your bets? And then would love to hear kind of more broadly, your perspective on the role of AI in all of this.
I think it's going to take several years. I've learned more about the CMS regulation and what is required on the part of health plans. And there's a lot of technological build that is going to take a long time, especially when you think about the millions of different decisions that they have to make every single day, and building out platforms to address every one of those transactions. It's going to take a long time. AI, when I started on this work 10 years ago, I was building my own rule sets, and there was no AI in this space. And now AI has come in and it's just going to lift it up. But I think that we have to be, there's a lot of concern about, well, is AI going to inappropriately lead to denials? We can harness AI to do all of the approvals, which is 80% of the transactions. And no patient or provider is going to be concerned about AI automating approvals. And so that's one role that is, I think, going to be very, very important and necessary at this time. The other role that AI has, and I see some vendors moving this way, is that at the point of care and in the decision making, the AI, there are certain areas of practice where the rules are pretty clear cut and the evidence is very clear cut, and helping the physician understand the evidence so that the decision making is aligned with the evidence. That's where AI tools are going to play a very big role. The problem is that as Tom pointed out, there's a lot of heterogeneity even in individual health plan rule sets, despite having one body of evidence. And until we get past that barrier, I'm already jumping ahead to the answer to the next question that you're going to throw out there, but it's a barrier that even an AI tool is going to have a difficult time overcoming when you have a lot of different, you don't have homogeneity in the appropriate use criteria, the medical necessity criteria. But I just think it's going to be a very powerful driver of fixing parts of this quickly and then fixing the harder parts with time.
Yeah, yeah, I appreciate that, and wish all the teams well in the tournament starting today. So Pam, you started to get into this, and we've been talking about the prior auth interoperability efforts, but there's a number of interoperability efforts underway in the industry right now. I'm thinking about even the health tech ecosystem work that HHS and CMS are leading to enable patient data sharing. As we look ahead, what should the industry prioritize to move beyond basic compliance? And I hear this a lot around the prior auth requirements. It's one thing to be compliant and another thing to leverage the fact that you're already having to do some technological work and upgrading to the systems to enable meaningful automation and action. So how do we prioritize in that world?
I think a lot of I think that the key is to have everyone at the table for the design process, because I've seen situations where the design is coming simply from the payer, or the design or the mandate is coming simply from CMS, and without a clear understanding of the barriers that the provider and the patient are navigating. And when we sit down together um, and try and design solutions to meet these requirements, we're going to end up with better results. And I believe that engaging the patient more in this process is critical. We had some platforms at Hopkins that enabled patients to submit their own health information through through the my chart, like a questionnaire that goes to the patient. The patient submits their own health information. They have time to do that. That becomes part of their whole medical record, and empowering them to be engaged and understand that a lot of the delays are related to documentation deficiency, and the ground truth for all of the details are with the patient, rather than simply one entity. So that's what I would like to see. I'd like to see more patient engagement in these solutions, and advocating for them to be activated for their own health care by participating in this whole automated process.
Yeah, and I think that aligns with a lot of what we're hearing CMS is trying to push as well, with the patient access APIs, enabling use of apps and et cetera to pull together your entire healthcare data set, not just for one physician or one health system, but being able to see that full longitudinal picture. Tom, your thoughts?
Um, you know, I think it is it's dangerous to underestimate the transparency into our administrative, shall I call it, uh, kind of labyrinth. The more transparent processes from denials management to prior authorization, the more transparent that becomes, both to counterparties in a contract, as well as the federal government. I think it's going to be really challenging, in an environment that fraud is a nasty word to throw around, but um, it's one that, if you're not making things more transparent, it seems like you're doing that for a reason. And so there's two kind of ways out of this, the the processes we have now. One is third party trusted platforms to actually take on the administrative transactions between existing payers and existing providers. There are numerous organizations who have tried in the past to kind of use different technology from blockchain to, pardon me, simple simple outsourcing of contract management services. Um, Unfortunately, I think the heterogeneity issue is not going to get any better. Um, the other alternative is to come to like one version of the truth. There is, and that really demands some give from both sides. One, from providers on what are the, nice way to put it, imperfections in their billing practices. From payers, what are the systematic processes by which we can now identify denials like aligned with very specific regional rules changes. And the reality is, nobody looks good in this game unless we come together to have transparency in a way that I think patients benefit, and the federal and state regulators smile upon.
Yeah. I totally agree, Tom, and I'm going to get on my soapbox here because I think transparency is key. I think collaboration is key. And then the other piece of this that we've touched on is the importance of standards and how critical those are to enable this ecosystem that we're envisioning, where we have full access to our data, our providers have full access to our data, billing and claims payment is seamless. It really requires the industry to come together and agree on a set of standards and protocols as to how we're going to do that. And I think sometimes that work gets taken for granted in the industry, or the patient perspective may not be included. And so sometimes that effort falls short or doesn't encompass the full perspective. So I would just encourage everyone on the call to get active if you're in an industry or as a patient where you're using standards or would like standardization to support that. There's countless industry work groups and efforts to get involved in that can help drive this progress forward. It is often taken for granted. And I just really encourage folks to consider how they can get involved so that we can continue to make progress in a way that benefits the entire industry and not just one organization or one stakeholder group. I am going to now turn back to our audience, and I'm curious their own perception around what do they see, what do you all see as the biggest barrier to accelerating electronic adoption today? And some of the things we've heard through our work with the index is that it may be just there's no ROI for it. You don't understand, or it's unclear that there's value in investing in those solutions. Interoperability challenges across systems. We just talked about that. Workflow disruption or operational complexity. One of the things I hear about prior auth is, 10 years ago, prior auth was a lot more simple. It sat in one department at each organization, and now systems are more connected. We're pulling data from multiple systems. So the automation and the breadth of stakeholders within an organization, like a health plan or a health system, is much broader. So it requires more coordination. Here we have our results. And it looks like regulatory uncertainty and shifting requirements is actually rising to the top a bit, which is interesting as well. When you look at the index data, prior auth, again, we had some regulatory changes related to prior auth, and then attachments, which is that documentation that goes with a prior authorization or with a claim to prove information or details about the service provided. We have lacked regulatory direction on a standard for that transaction as well, and it is the other kind of lower adopted transaction reported in the index report. So I think that's key. But the fact that all of these are kind of bubbling up and nothing's above 50% tells me that we have a lot of different areas to work on within the industry. I'm now going to open it up for questions from the audience. So feel free to add questions into the chat. I am happy to ask. We have a couple already coming through. One question is, I'm just kind of scanning through here. Of all the technologies we discussed today, we have AI adoption, interoperability progress, stronger system resilience. Is there one thing that we should prioritize first? Like, what will have the biggest impact on driving greater automation from your perspective?
Do you want to take?
Oh, sorry. Yeah, I'm sorry.
Either one.
Yeah, actually, I'm glad that this question was asked because I think that one of the most important things that we need to do is to move towards one set of evidence-based rules. And as a physician, when we did the CMS program, we did the literature review. There's one body of evidence. There are clinical practice guidelines. The cardiology clinical practice guidelines are very clear cut. And that's what we're following. And when there are those types of resources, the government there can be regulations around that. Many of the states have done this. California has a law that says you may not deviate from clinical practice guidelines for behavioral health, resource utilization management. And there are opportunities for this where if we could move towards one set of appropriateness and medical necessity criteria, it will rapidly accelerate. Without that, all the automation in the world isn't going to solve this problem globally across the country. So that's what I would advocate for.
Yeah. It is, I'll say this. I think one of the most I agree that having one set of clinical rules and a source of truth for for providers, payers alike, it would be would be essential. Um, I I also think just it does come back to our payment methodologies and how we value um, for, cognitive versus interventional medicine. Um, the the reality is, um, if denials management is if what we see uh, coming true is that almost all claims are paid, they are just not paid at the allowable rates. Um, Maybe there's something wrong with the rates. And so I'd like to see more involvement from the AMA and the federal government to talk about what exactly are we fighting over if we can achieve 90% 90% claims payment, but it's 60 cents on the dollar on average for those 90% claims. I kind of come to the fundamentals of a lot of work is being spent based on uh, choices that are being made not by the providers and not by the payers.
Yeah. It's interesting, Tom, because I feel like, I was at HIMSS last week, which is a big health IT conference, and a lot of conversation there stemmed around we have all the technology solutions. We know how to automate claims. We know how to automate prior authorization. That's not the challenge today. It's not the technology anymore. It's the policies, the workflows, and all that kind of sits behind and creates that infrastructure that we need to align on. Um, so I just want to thank you both for, a really thoughtful discussion today. And I think, if there's one thing that came through clearly, it's that we have made meaningful progress as an industry, but at the same time, there is still substantial opportunity and barriers to overcome. And, we encourage you all to use this data to guide decisions, to quantify ROI, and really to help move the industry more quickly. So thank you again for your engagement today, and really appreciate you joining this conversation. And please take a look at Index Pro, use the QR code. Our team is happy to support you in any way, and have a great rest of your afternoon. Thank you.
Thank you.